Oh dear. Oh dear, dear me, dear me. Oh, this poor unfortunate soul. Hello, you're awake. Shh, relax, it's okay. You're safe, I promise, I promise, I promise. You were lost in the woods, it seems. Yeah, out for a hike. Little fall hike, a little close to Halloween. You come across a little forest, a glen maybe. Something that wasn't on your trail map. And now you're here. Well, my friend, you're safe, I promise. I promise, I promise. But you got lost in a magical forest. And you're lucky I found you. I was on my way home from an appointment at the ogre that lives under the bridge a couple miles away, and I found you laying against a tree, banged up. Yeah, you can hear the storm outside, and you were trapped in that, but you're safe now. Oh me, I'm a doctor. Well, retired. That's why I live alone in the woods. It's a whole thing. I have, let's just call it deals with the creatures that live here. I help them, they leave me alone, and I take care of the random human that wanders in. Relax, you're okay. Well, not really, you are very injured, but you shouldn't feel any pain. No, you're okay. I do think you, maybe got the winter sprites a little ticked because they are throwing the northern winds down very hard. But it's okay. So I hit you with a little time spell. So you're trapped in a little bubble at the moment, and yes, you cannot move, but it's okay. I need to examine you and make sure that I can fix you. Well, what do you mean? Oh, well, I'm a wizard, too, and a doctor. Don't call me doctor. Wizard, do not call me. Stephen and I are not friends. He was a good surgeon. He is absolutely reckless. Oh, you are not good. But we'll take care of you, I promise. So why are you out here? Just a hike. You weren't looking for any particular creature, were you? Well, Maurice wandered a little too close to the road, let's say a month or two ago, and I still have internet. And reports of a unicorn sighting have been a little too high for our liking, so if you could just keep that quiet. There are no unicorns in this woods, do you understand? Beautiful. So let's take a look at you. Let's see, we got a little bit of a laceration here in the head. We can take care of that. A little bump, but we can magic that away. That won't be a problem, I promise. Take a look at your neck here. Okay. So you definitely got bit by a vampire. Good thing I hit you with that time spell. That poison's not moving, but we will have to take care of that. Alright, do you remember running into anything else at all? Okay. And your shirt is ripped over here on your side by your ribs, and those are claw marks. I think you gotta run in with a werewolf as well. That's fun for you. You did not have a good day, I'm so sorry. But we'll take care of you, I promise. And you have it almost looks like frostbite right here above your heart. How about your legs? Do you remember any problems? I'm not seeing anything visually, but I'm not supposed to show regular people this, but we will have to use a little magic on you. Alright? So, it's just a wand. It's just a wand. Just a wand. Nothing sinister. Not in my hands, you know. The whole do no harm thing. So we are just going to do a little bit of an aura reading on you. Looking for any other damage. Okay. I'm not getting too much back here. Just a werewolf bite. Or scratch, I should say. The vampire bite. That spot on your chest, though, I think you may have been invited to play a game of tag with the winter sprites. And I believe you are it, but you don't want to play a game with them. They're not always the kindest. Alright. Let's get that blood cleaned up on your neck. Okay. It's gonna be alright. You're not gonna turn, I promise. It's kind of my job here is to make sure that if any of the residents of these forests get out of hand, I fix up any humans they have a run-in with before they go back. Alright. Oh. Just gonna disinfect it a little bit. Why am I not using magic? Well, I will be. There's some things that I cannot cure, but flesh wounds, good old-fashioned human medicine works. Alright, just keep. Alright, so that'll close up nice and neat. You won't even have a scar, I promise. But that is a vampire bite. You know what? You're gonna drink a little of this. Just a little bit. Just a bit, just a bit, just a bit. Good. No, that's just gonna help cleanse the vampire toxin from your system. And lucky for you, I was already working on a poultice. Halloween is coming up. We need to be prepared. It's inevitable. We get at least 1, 2, 3, 10 people here. I don't know. But it's our job. Just finish grinding this up. There we go. Alright. So I'm going to take a little bit of this. Just going to rub it on your neck here, right over those puncture marks. Help heal and draw out any of that toxin that's left near the surface. And you won't have to worry. You'll be A-okay from being a vampire. I do need to check on something though. I'll listen to your heart. I'm not too worried about the lichen wound just quite yet. It's not festering and the time bubble should keep you fairly intact for the time being, so I'm just gonna listen to your heart real quick, because I think if the winter sprites did what I think they did, they give you a touch of cold heart, which it's not the worst thing, but yeah, you'll never be completely warm again if I let you live with that, so okay. Alright. they definitely catch you with a little bit of a cold hard touch, but we can cure that. A little liquid sunshine. So you're gonna drink this. Drink, drink, drink. Come on, drink it all. Good, good, good. So you're gonna rest here tonight, and you're gonna finish the rest of that bottle, and by about 48, 72 hours from now, you'll feel perfectly fine again. Basically, they just got you with a little bit of a prank. Not deadly, but not fun. I'm more concerned about this lichen wound now, though. This is going to be a little more complicated to treat. Alright, so I'm going to take a look at it, and then we're going to work on actually getting rid of the lycanthropy inside of you. Because that is something, unlike the vampire venom, the lycanthropy is going to take a little more magic, unless you really do feel like hunting than a werewolf. And if it was the one that I think it is, the only one that lives around here, you won't win. And frankly, it most likely was an accident. I don't think it was that werewolf, but, you know, we'll investigate on our end. So hold still. Again, you shouldn't feel any pain here. Alright. Okay, we're gonna have to use some magic. Alright. So this isn't gonna be directed at you. We're gonna do something a little odd. See, I need a little moonlight. But being that it's all stormy out and the clouds are in the way, I'm just gonna borrow the moon for a minute, okay? Things should be alright. I think the Earth will survive for 5 minutes without a moon, but let's just get it out, huh? Okay. And if the light goes bright, don't worry about it. Don't worry about it. Alright, I'm just gonna pull that in and... the moon. Got it. Cool. Now that we have the moon, we can actually get started. So the basis of lycanthropy really comes down to the activation of the infection in the blood by the moon in my hand. It's magic. Don't ask questions. But by using moonlight, we can burn out the actual infection. This won't hurt, but you may feel a little dizzy. So what I'm doing is forcing out moonlight into your eyes, and it will seep in to your skin, into your blood, and burn out that nasty little infection. Don't worry. You won't become a werewolf, I promise. And if you were, well, you can hang out here in the woods with me. Alright, we're just gonna stick this back up there. Hold on. Alright, hopefully that stays, because don't want to throw the tides off too badly. It should just be a little windy tomorrow, but yeah, it should be alright. How are you feeling? type spell, I'm sorry. Hold on. Tap, tap, tap. Okay. Now, how are you feeling? Good. Drowsy. Yeah, that's to be expected. But your neck's looking better. The wound on your side is all done. That's all healed up. Moonlight does magic, honestly. I wish I could use it for everybody, but it only works on lycanthropy. And, you know, that's not every day everyone's running in with a werewolf. But you are going to be drowsy, so we're going to keep you here tonight. We have spare room in the back for patients just like you. Do you mind if I give you a little exam just to make sure that the human parts are working as intended? Is that alright with you? Great. Alright, so you know what? Let's start with the eyes. I'm just gonna get real close to you. Just gonna take a look inside your eyeball. Good. 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 Alright. Look on the other side here. Oh, your eyes look intact. Not seeing any change in the ocular nerve, which is good. Frankly, that's one of the first things to go with either vampirism or lycanthropy, so it's good. Speaking of the eyes, I'm going to test your pupils because, again, I want to make sure that we're not seeing any kind of transformation happen. Okay. Good. Good. Just in and out. Just making sure that your pupils are working properly, like a human. Good. Very happy so far. Let's make sure you're still cognizant. Just a quick little eye test if that's alright with you. Just read them. Just want to make sure you can still, recognize letters. Good. 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 Very good. 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 Very good. 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 Alright. So that's still intact. Just very happy the eyes haven't changed. Frankly, I always check the eyes first because there's going to be a change. It's going to happen there first. Do you want to look in your ears, though? Just to make sure that those haven't changed. Take a peek. Just gonna put the otoscope in slowly. Very nice. A little dirty, but you were attacked by multiple creatures, so that's understandable. Let's check the other side. Same thing over here. Nice. Very good. No noticeable changes. Still looks human. That's what I like to see. I'm sure you're feeling a bit relieved. Right. Now, this next part, I'm going to ask you to open your mouth for me. Say ah. Just keep your mouth open. Just look for any changes to your teeth. Elongated canines. Things like that. Recessed fangs. Okay, good. Open big. Stick your tongue out and say ah. Just looking for venom sacs in the back of your throat. Make sure there's no vampirism left. Good. Good. If at any point during the next 12 to 24 hours you feel any kind of burning, like in your blood, let me know, because there is a lot of garlic in that paste I put on your neck. And that will definitely be inside of you by now. Alright. So your mouth looks good. Let me feel around your neck and your jaw here. Good. Lymph nodes feel normal. Okay, no venom sacs on the lower jaw, that's good. Not all vampires develop them in the throat, so it all really depends on who. Okay. Do a little hearing test on you. This is a very high-pitched tuning fork. Just gonna ring it. Let me know if you can hear it. Good. Good. Now I'm gonna ring it at a very high frequency that you shouldn't be able to hear. Alright? Can you hear it? Good. Other side. Can you hear that? Good. I would have been concerned if you could. You're not supposed to hear that. Okay. Make sure everything else is working properly, and I do want to make sure that that cold hard touch isn't spreading. We're going to do a little sensation test where I'm going to touch you with a soft object or a blunt object, and I just need you to tell me soft or blunt, okay? So close your eyes for me. Close them, close them. I know it's so windy, but don't worry, you're safe here, out of the storm. So close those eyes. Here we go. And touch. Good. Blunt. Touch. Good. Soft. Touch. Good. Blunt again. Touch. Soft. Touch. Soft again. Touch. Soft. Touch. Blunt. Touch. Blunt. Touch. Good. That's soft. Touch. Good. Alright. Well, it seems the cold hasn't penetrated your skin, so hopefully the liquid sunshine has it isolated to your heart region for now. Again, it's not going to cause problems. It's just going to take a few days to go away. In the meantime, where did I put them? Those little sprites do trade away some fun things. So we have a fey candle here and some fey fire. This cost me way more than you would like to know. So what I'm going to do is we're going to light this candle. And you're going to lie back there. And you are going to go to sleep. But what this candle is going to do, it's going to put a little bit of a fey aura in the air. And this should help to dissipate that little bit of magic they set on you. So, I just want you to follow the light. Just follow the candle and go to sleep. Let your body heal. Let the magic work through you. Let it seep through your bloodstream. Let it dance over your skin. Let it linger in your mind. And know that you are safe. You are protected. And you are healed. And you will stay safe. And we will return you to your friends. But for now, you're just going to sleep. 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 And when you wake up, you will feel amazing. The The day will be bright. The day will be sunny. And you will forget everything that happened. And you will go back home. And you will be happy. And you will live the rest of your life with a little magic inside of you. So go to sleep. Go to sleep. Go to sleep.